This video is disseminated by Rocket Doctor AI. Welcome to Soft Therapy with Penny Queen. Today I have the CEO of Rocket Doctor, Dr. Bill Cherniak here. Welcome back, Bill.
Thanks. Appreciate it.
All right, you have really exciting news today. You are now in network with Maryland for Medicaid and Medicare, and that they cover more than 2.6 million people combined. So I know your existing footprint had been California, New York, and the Canadian provinces of Ontario, Alberta, and British Columbia. So you've really expanded your coverage map. And I just wanted to put some numbers on it for people so they understand. So Canada, that is almost 25 million people in those three provinces that can all use the platform. And between New York, California, and Maryland, there's 31 million people combined on Medicaid and Medicare. Can you walk us through that at all?
Yeah, definitely. So we basically tackle what I joke the closest thing to the Canadian health insurance market in the United States, which is, as you say, Medicaid and Medicare. Federal mandates devolved to the states to really build their own programs. And so the numbers you cited are correct. There's that many folks that are on some form of Medicaid and Medicare in those states. And then once you're in network with those kind of state payers, you can subcontract with the managed care plans for Medicaid and the Medicare Advantage plans on the Medicare side. And so super exciting that now we're able to start that process in Maryland as a third state in the United States. And as we've announced previously, we've already started on both Medicaid and Medicare in both California and New York as well.
All right. So now Rocket Doctor is more than a telehealth company. Can you make it crystal clear to people who are watching exactly what the company is?
Yeah, for sure. I think that when people think about quote unquote telehealth or virtual care, the first thing that comes to their minds are these companies that existed before the pandemic that largely were virtual walk-in clinics, virtual urgent cares that served a purpose at the time, but we saw their stocks not do so well as people kind of realigned with expectations. And where we are is we're a technology company. We build software and systems that powers healthcare to be better, more efficient, improves physicians' lives, to launch autonomous practices. Then we coordinate them into this sort of marketplace that we put out to patients on Medicaid, Medicare, rural remote communities across Canada. And there we drive the patient volume, revenue, and improve the whole healthcare delivery package. And again, not just a walk-in or urgent care, but ongoing longitudinal care. So a doc can order your labs, imaging, make specialist referrals, book follow-up appointments, and truly be your physician, but working in this more innovative cloud-based model with hundreds of other providers across the province or state that they're living in, basically.
All right. Can you talk to us about the focus on Medicaid and Medicare?
Yeah, I mean, I think what I saw the last number of years is that every digital health company was going after the cash pay market. They were going after HR employer benefits, commercial market, some extent into Medicare, but really not very well and not too, boldly. And then into Medicaid is really just a blue ocean where I think people tend, for a variety of reasons, to just say, we're not going to deal with it through, a lot of kind of misperception and a misunderstanding of how it works and a little bit added complexity. But again, I always joke that it's the closest thing to the Canadian single payer in the United States. So we have a natural advantage to kind of dig in and understand it. I also, did my public health degree at Hopkins and spent some time working in South Baltimore and saw a ton of patients on Medicaid and Medicare coming to the hospital. And so it was a natural extension to just really focus in on that part of the market.
All right. So let's talk about Maryland now. Their ahead model emphasizes equity and cost reduction. How does Rocket Doctor's platform align with those priorities?
Yeah, I mean, typically, patient who has Medicaid has to find a provider who takes their insurance. And so that's the first roadblock because most just don't. So then, if a provider does take your insurance, you then have to call their office, and the office might not answer the phone, might not call you back, might tell you Dr. X is on vacation, they'll be back in a month. So there's a million different roadblocks to trying to access care. And then that physician may not want to see you because maybe they have a multi-layered practice, multi-payer. So, our whole thing is, okay, we've got all these physicians across the state. we make it easy for the doctors to take Medicaid. We make it financially lucrative for those physicians to see those patients. We organize a system of care around them to streamline and optimize things to make it more simple with digital tools and care coordination otherwise. And then we put them out to patients who otherwise might have to take, 3 buses and miss a day of work to get to the doctor's office. You just open your phone now, you get a doctor same or next day that's ready to see you, and you can use your health insurance. So I'm improving both of those facets pretty nicely.
You said something there. You said same or next day. Goes right into my next question. Medicaid and Medicare. What is the average time from booking to provider visit on your platform?
Yeah. So our patient care coordinator, every person that submits a request for a booking gets a call from a live human. They're able to help them organize the technology, book the appointment. That call from a care coordinator happens typically in 15 minutes or less. And then to actually see the physician, 90 something percent of the time, it's the same day or it's going to be the next day that you get an appointment for.
And that's not typical for Medicaid and Medicare patients from everything I've heard. I hear my parents complaining about how long it takes them to get an appointment on Medicare, and I think it's like a month sometimes. So
Yes. Mhm.
this
There's
is
lots of
that's a big improvement. I mean, that in and of itself would be very convincing for me as a patient. So, right. Well, how do you handle continuity of care? You kind of addressed it before, but we've got labs, prescriptions, chronic disease follow-ups, and for rural patients that can be even more difficult.
Yeah, I mean, our platform is designed to make it easy for doctors to order the things that a patient needs for their whole healthcare with all the stuff you just mentioned. We also have a back end process, so the care coordinators, as well as different clinical folks that are supporting the doctors, can follow up with patients to make sure that stuff gets done, help with any prior auths that are required. Maybe they need to track down a location of something, so the team's available there. And then we have a patient portal as well, so folks can log in, they can see what labs the doctor ordered, imaging forms, they can remind themselves when their appointment was, they can securely chat with our team to book a follow-up appointment. So we try to make it as streamlined as possible, basically.
All right. Mental health care is highlighted in your Maryland offering. How significant is mental health demand compared with other services?
Yeah, I mean, it's almost impossible to find a psychiatrist these days that doesn't charge $400 to $500 an hour on a cash rate. So to get, mental health in Medicaid and Medicare is very challenging. We've had an existing program in New York with EngageWell, funded by New York Healthcare Foundation, CVS Healthcare Foundation, that's had mental health woven in and integrated with primary and urgent care. So we're taking that model to Maryland. We've got a focus on the same in that state with an initial group of providers with substance use, mental health, otherwise, and so we're doubling down on that and building up that system.
So now that RFK Jr. and Dr. Oz have announced the $50 billion rural hospital transformation program, how can Rocket Doctor fit into this?
Yeah, I mean it's a no-brainer in a sense because we're taking these physicians who may largely be in big academic centers and big cities. We're putting them onto the platform, and that these doctors understand when they sign up for us that they're going to be provided with patients in need in diverse areas and in rural communities. So they're already coming in with the mindset of, okay, I want to see these patients. That's part of the reason I'm here in the first place. And then we can beam them into patients' homes in those rural communities with a good system of care where there may be like a single provider trying to manage a town of 5,000 people. We can now bring in, docs from a big academic center that can come in, and we can partner with hospitals that are receiving the rural health funding who maybe are struggling to recruit providers and say, hey, we can work with you to boost capacity of the group you have locally and prevent them ideally from burning out as well by leveraging technology. We've been a defined rural health vendor for the state of California through their Path Cited program for a couple of years now. And so we've had good experience there and happy to keep growing and expanding that program.
What does success look like for Rocket Doctor 3 years from now, financially, geographically, and clinically?
Yeah, I mean, this is a forward-looking statement to some extent, so just a notice on that. But I think one thing that's really easy to say is we have clear earnouts actually from Rocket Doctor under the terms of our deal with RDAI, and for that, we're doubling revenue year over year, and that's been publicly announced, and I fully intend to hit those metrics. And then more tangibly, you look at what we've been announcing lately about new payers that we're contracting with, new geos that we're coming into, like Maryland. Think about Maryland as a smaller, more straightforward state. There are 40 something states that look a lot like Maryland, California, New York, big complicated states. There are a couple other states that look a lot like them. We're not currently in. So you just kind of extrapolate to what we're planning in the days ahead to hit those revenue targets. And those are those are the conservative estimates for those revenue targets as well. So that's the plan.
Excellent. So this has been absolutely fantastic news. I am really pleased with the speed of expansion and everything I've been seeing out of you, especially the 89% gross margins on the Q2. Really happy to see that. I'm starting to put that together with some of the other little tidbits of information I have to start build my own personal model for what I think the value is. Clearly nothing I'm going to be putting out here, but very exciting for me. And I appreciate you coming on here, and I'm sure I will see you back as soon as you have more news. So thanks for being here.
That's great. Thanks.